3 years ago, my mother passed, and it was very difficult for me. And if it wasn't for Lower Lights, I'd still be blaming myself. I'd probably be a bum on the street somewhere talking to myself. And without them to help me control my illness, I wouldn't be the person I am today.
So I've been working with the Voderick family for a long time, and I've seen them go through many, many challenges. And one constant in their life is that Lower Lights has always been there to support them and help them in their times of need.
Dr. Drake is my caretaker, and she's my rock. And she also is seen that way with my daughter, Faith, and my 3 grandchildren.
When I was 19 or 20, I was diagnosed with fibromyalgia, and that was a very hard diagnosis to get to, and without Lower Lights, I would not have gotten there. I would not be getting the treatment I am now for it, and I probably would not be able to be a server 40 hours a week without that.
Faith had a very challenging upbringing, and she had to learn how to survive and brought that on into her adulthood. For me, it's been a privilege to work with her and walk this journey with her.
Susan Kennedy has been my counselor, I think, for about 4 years now. She's helped me through so many different struggles, and I've just never felt a deeper connection with someone so isolated from my family. It's really nice to have that.
I love that we are ministering to the whole body. We have medical, we have spiritual, we have behavioral health. So one person could come here and receive all of those services.
Lower Lights is a really special place where people can find health care that wouldn't otherwise have that opportunity, whether it's because they're uninsured, they're undocumented, they can't find anywhere that will take their insurance. Lower Lights is a safe place for people to come and get health care and also care in many other ways.
We work to deliver care to patients that are in difficult situations. Particularly the pharmacy looks to find creative ways to dispense medications to patients. And like a lot of our patients that come here, they needed our assistance in a variety of ways.
They help you get insurance, and if you're not able to, they do the sliding scale. And we appreciate that because there's times that are rough and we don't have medical insurance. So they hold no prejudice and they praise you and applaud what you have done.
Well, I think the big difference from when I started working with them is the trust that they've put in me. If you trust your provider and you can be honest with them, then you can really get to the bottom of healthcare concerns that you need to address.
When I went to the appointment, I was on a lot of drugs. And I didn't want to do them anymore. I think she saw right through me.
During that appointment, she felt really guilty and ashamed.
And she's like, well, we have a program here called the MAP program. What? You can help me?
I was able to tell her that I could get her that very same medicine that she needed that same day and that she wouldn't have to look for it on the street anymore.
So I had a new outlook on my life from that point. And it's almost 2.5 years without anything.
It's been really powerful to work with her, and she's been really strong and really courageous in the journey to sobriety, and it's been a privilege to walk with her in that journey.
With my kids going to Lower Lights, I feel like they have also been heard by our primary care, especially my 9-year-old Melissa. You know, she's seen psychiatry and counseling, and I feel like at other places it may not have been so easy to get those kind of services for her. My hope is that with her getting good mental health care now, she'll be able to be set up for success in the future.
When you donate to Lower Lights, you are investing in a life, whether it's an elderly person, a middle-aged person, a young adult, or even a baby. We are grateful.
The care that I received from Lower Lights helped me live again. and know that there is hope and help and treatment right where I was sitting.